Hi there, Dr. Kane Treble here to help you out on your KFP journey. We've got some timed KFP questions ready for you today, so let's get to it. And coming up to the next question now. And coming up to part 3. And of course, that is coming up to time. Let's go through the answers. So this first case here, we're saying what is the most likely differential diagnosis? Write 2 specific diagnoses. Remember, we want to be concise, specific, and we want to avoid overcoding as well. So this is all leading towards a more kind of mastitis-y type picture, but we're going to be specific. So we're going to say this is an acute, this is new, this is a bacterial infection, and it's a mastitis of the left breast. So we're specifying which side is actually involved here. Now, less likely, but this could also be breast abscess, and so you would specify acute breast abscess of the left breast. I probably wouldn't put both of those as the 2 responses. You want to try and diversify your answers as best you can. This could be other things as well. This could be an inflammatory breast cancer of the left breast. Again, we're trying to be as specific as we possibly can. If you were to put something like breast cancer, you're probably still going to get a mark, but I don't think you'd get full marks for it. And of course, this could be something a bit more benign. This could be a simple duct occlusion within the left breast, but there's enough other infectious features there to make me say, look, you're probably going to get more bang for buck specifying the acute bacterial mastitis. Let's see how we went for section 2. So what initial management options are appropriate? Write 5. Fantastic, because for mastitis there is a heap of things. Now if this isn't something you're familiar with or something that you've seen much in clinical practice, I'd recommend having a look at this paper here from 2011 from Australian Family Physician. Given the infective features here, I'd probably start this patient on oral flucloxacillin or dicloxacillin as first line from ETG. Dosing's not required, so as long as you specify one of those, you should get full marks there. You want to support continued breastfeeding with education and reassurance to alleviate any occlusions. Again, we're specifying what we want to do and why. So it's not just a reassurance. We want to reassure that we can get through this. It's something that can resolve with emptying of the breast appropriately. Tied into that a little bit is regular and complete emptying of the drainage of the left breast using a pump if needed to drain infection. We want to try and get as much of that infection moving. So again, specifying why we're doing it. You would consider referral to a lactation consultant or an Australian Breastfeeding Association support person would get you full marks. Again, if you wanted to really be good, you would specify for lactation education or breastfeeding education. Simple analgesia taken regularly, such as paracetamol. I think it's always good to suggest one option. Again, in this situation, dosing's not required. Hot packs before breastfeeding, cold packs after breastfeeding. Now, it's tempting here to try and lump these together as to the one response. However, it's probably veering into overcoding. You're probably better to have them separated. And in the actual exam, I'd probably only use one of these responses, just in case they would consider it within the same category. Of course, you want to organise a review of this patient. These are patients that can unfortunately go downhill and not improve without more aggressive management. And so I'd be organising a review of this patient in 24 to 48 hours to ensure improvement. So we're also specifying what we want to do and why, being nice and specific there. Now, if we were particularly concerned about malignancy, for example, we'd be specifying for biopsy of suspicious lesion for malignancy. Getting some marks there. Again, if there's something that you're not familiar with, I'd have a read through this paper here and have a read through ETG as well. Let's have a look at the next question. What are common postnatal concerns for mothers in the first 6 months that you could inquire about? Boy, is there a lot, particularly if this is a first new mother. There are so many things you want to be asking. Again, if this isn't something that you're seeing much in your clinical practice, I'd have a read through this paper here. But this is something that I think is pretty bread and butter for day-to-day GP. I know certainly up in here in Mildura, one thing we do very well is breed, and so seeing newborns and care around that postnatal period is pretty routine for us. Now, of course, one of the things that's always in our mind in young mothers is going to be things like postnatal depression. So inquiring about mood, psychological adjustment and postnatal depression, specifying even doing the postnatal depression screen. You could ask about vaginal blood loss. We'd be concerned about endometritis, for example, perineal or caesarean section wound pain, tiredness or sleep patterns. As a father of two, I miss sleep. And in particular, if this is a first-time mother, it's a lot of adjustment, a lot of waking up through the night, and if everything else is going wrong and you're not sleeping on top of that, it can be devastating. So this is a really, really good one, regardless of this exam question. Check how sleep is going and see if there's things you can do to optimize that. Backache, very common problem after delivery. Urinary and bowel symptoms, of course, are always going to be 3 points for not much. Rectal bleeding or hemorrhoids, incredibly common. Breast and nipple tenderness, we've already established this patient has had mastitis. We could inquire about breast and nipple care ongoing if there's any troubles with that, see how the latch is going, see how feeds are progressing. Of course, there's also sexual problems, important to establish after any delivery what the contraception plan is moving forward. Again, sexual problems aren't normally an issue this early after delivery, but it can be something that can be distressing for young mothers if it is something they want to be engaging in but feel like they can't yet. And of course, contraception incredibly important in the early stages after delivery. And of course, tied into that as well is just general relationship issues. It does take two to tango, and so it's a good opportunity to also inquire, well, how are things in the relationship? How is dad adjusting to having a new baby as well? For completeness. And again, if you aren't seeing this day to day, I'd have a read through this paper. Excellent paper here that also has some excellent little summaries of things you could be inquiring about. So, how did you go? Do you agree with these answers? Disagree? Let me know in the comments. If you found this helpful, subscribe for more questions coming through on hopefully a regular basis. And of course, for more resources, check out generallypracticing.com. Thanks. See ya.